Work at Animal Biosafety Level 2 is suitable for work with animals infected with biological agents that are associated with human or animal disease whose route of transmission is primarily through cuts or breaks in the skin, ingestion, and splashes to the eyes, nose, or mouth. The risk of infection from the inhalation of aerosols has been determined to be low during the risk assessment. Agents that fall into this category are often referred to as Risk Group 2 pathogens. The features of an Animal Biosafety Level 2 research facility are similar to those found at Animal Biosafety Level 1, with a few additions. The air supply and exhaust system maintains a slight negative pressure within the room, creating an inward flow of air from adjacent spaces. A hand-washing sink is accessible where infected animals are handled or housed, and an autoclave in the animal facility is used to decontaminate biohazardous waste. Surfaces within the animal room are easily cleaned and are routinely decontaminated with an effective disinfectant. The door leading into an animal facility is secured and only authorized personnel may enter. Before conducting any work in an animal room, a gown, disposable jumpsuit, or dedicated lab coat should be worn over street clothes or a standard uniform. Lab coats should be buttoned completely down the front. A surgical mask often provides nose and mouth splash protection and also provides some protection for the animal. Safety glasses or a face shield are worn to protect the eyes from splashes. Gloves are required. The gloves selected should be long enough so that they extend over the cuff of your lab coat or gown, protecting your wrist from contamination. Banded cuffs on coats or gowns assist in protecting the wrist by preventing the sleeve from riding up the arm. Check for any holes or breaks in the gloves as you don them. This is the standard attire typically worn when conducting work at Animal Biosafety Level 2. Additional or alternative protective clothing and equipment may be specified in some instances. This will be determined by the protocol's risk assessment. For example, some protocols may require a hairnet to protect immunocompromised animals. A back-fastened gown may be specified because it provides additional protection from frontal contamination. The surgical mask can be replaced with a respirator to limit your exposure to animal allergens. Booties may be worn to prevent contamination of the shoes and the tracking of this contamination throughout the facility. Double gloving is also common and generally recommended when working at this level. Double gloving allows one to strip off the outer glove and replace it should it become contaminated. A second glove also adds another layer of protection. Because individuals are at increased risk when working in an Animal Biosafety Level 2 room, access to the animal room is limited to the fewest number of individuals possible. Individuals entering must receive specialized training and a medical clearance for work with animals. The training describes the potential hazards associated with the work, the appropriate precautions to follow to prevent exposures, emergency and post-exposure response procedures, and the signs and symptoms of infection. This training is repeated regularly, typically annually, or when necessary to communicate changes in procedures or policies. Individuals found to be at increased risk of acquiring an infection during the medical clearance procedure, or for whom infection might be unusually hazardous, should discuss their condition with an occupational health physician and should not enter unless the risk is adequately controlled. Depending on the biohazardous agents handled, personnel entering the facility may also receive immunizations and participate in other laboratory testing. The biohazard sign posted on the entrance of the room will list the room entrance requirements, the agent in use, and contact information for the investigator responsible for the work. Work with animals in an animal biosafety level 2 room may be conducted on the open bench, but most work is conducted in a containment device such as this biological safety cabinet. Prior to beginning your work, work surfaces should be wiped down with a disinfectant specific to the infectious organism being studied. Some individuals may find it difficult to reach the back of the cabinet. In these cases, assist devices should be used to extend one's reach. Never place your head inside a biological safety cabinet to reach to the back of the cabinet. Next, gather all of the materials and supplies you will need to conduct your work and arrange them in the cabinet or on your work surface, so you will have easy access to them. At this containment level, it is common for animals to be housed in a primary containment device, such as this static micro-isolator cage or a negative pressure ventilated cage rack. These devices minimize the release of aerosols. If a risk assessment has determined that a static micro-isolator cage or ventilated cage rack is necessary for housing the animals, typically due to the shedding of the biohazardous agent by the animal, then the cages should be transferred to, and animals handled in, a Class II biosafety cabinet. The cage is opened in the cabinet and all procedures conducted there. If a procedure you are performing may create aerosols, dust, or splatters of biohazardous materials, it should always be conducted within a cabinet or another physical containment device. Examples of aerosol-generating procedures include a necropsy or the harvesting of tissues or fluids. If for some reason you cannot work in a cabinet while performing an aerosol-generating procedure, then a respirator and full face protection must be worn. Another aerosol-generating procedure is cage changing, and a special biosafety cabinet, one equipped with a cage dumping station, is typically used to contain aerosols when changing cages. Fecal material found in the bedding may contain more than 1 billion organisms per gram, and this would severely contaminate the animal room if the bedding from the cages were dumped outside the cabinet. Always change cages in a cabinet, and never place your head inside the sash of the cabinet while working or cleaning up. This will potentially expose you to these hazardous aerosols. One of the most important work practices to remember when conducting work at this biosafety level is to avoid the use of sharps whenever possible. If a sharp must be used, select the safest sharp possible and follow safe sharp practices. Safe sharps are designed to immediately cover the needle or blade after use, making it less likely for a puncture or cut to occur between use and disposal. Blunt-tipped instruments are also examples of safer sharps. When working at Animal Biosafety Level 2, try to limit the use of sharps to the inoculation of animals or the drawing of samples, and, if possible, replace glass containers or tubes with plastic substitutes or mylar wrap tubes. If you must inoculate an animal, load the syringe in the cabinet. Wipe the injection area with disinfectant, inoculate the animal, and immediately discard the needle and syringe in a sharps disposal container. Wipe the injection area again with disinfectant to absorb any inoculum. Safe sharp techniques are illustrated during this animal necropsy. The animal is humanely euthanized. The euthanized animal is secured to the disposable cutting board with tape rather than pins. Pins are considered sharps and can cause punctures. Blunt-tipped instruments are used. Forceps keep the fingers away from the cutting area and from touching the animal. The necropsy is being conducted in a biological safety cabinet to control aerosols that are generated as tissues are manipulated or sliced. A scalpel with a sliding shield is used, and the shield is activated between uses. Disposable sharps are discarded in the sharps disposal container located in the cabinet, and reusable sharps are placed in a container of disinfectant. Reusable sharps, such as scissors and forceps, must be disinfected and cleaned after use. This can be done by placing them in an unbreakable container with an appropriate disinfectant. Arrange the sharps so the sharp ends are separated. If disinfecting a large number of reusable sharps, place the sharp ends on one end of the container. Scissors should be opened so the disinfectant reaches all surfaces. After soaking for the appropriate contact time, any residual debris may be removed with a brush. After removing the debris, return the sharps to the disinfectant and allow them to soak again. Animals are typically handled by hand at Animal Biosafety Level 2. However, when performing especially hazardous procedures on animals, such as a blood collection on an animal infected with a biohazardous agent, or inoculations with biohazardous materials, consider using a mechanical restraint, such as this tube, or a chemical restraint, such as an anesthetic. When working with larger rodents, consider wearing Kevlar gloves underneath an exam glove, which is useful in preventing cuts from scratches, but does not protect against punctures. Once you have completed your procedure and you are ready to return the cage to the rack, reassemble the cage and decontaminate its outer surfaces by spraying or wiping down the cage with a disinfectant specific to the organisms present. All sides of the cage, including behind the card holder, along with its top and bottom, must be disinfected. When finished, set the cage aside to give the disinfectant time to work. You must also remove or disinfect your outer gloves before withdrawing your hands from the cabinet, or if they should become contaminated with infectious material while working in the cabinet. This researcher is removing her outer gloves and placing them correctly in the biomedical waste. Another researcher has chosen to decontaminate her outer gloves by spraying them with disinfectant and rubbing the gloves together as if she were washing her hands. When using this technique, it is essential that you have selected an outer glove that is resistant to permeation by the disinfectant. Always allow the appropriate amount of disinfectant contact time before removing your gloves, cages, or any other equipment from the cabinet. All items in the biological safety cabinet, as well as its interior surfaces, should be completely decontaminated with an effective disinfectant before you exit the animal room. If you are using some other containment device or work surface, it should be completely decontaminated. The first step is decontaminating any samples and waste that will be transported out of the animal room. If biohazardous samples will be removed, the primary containers should have a screw top. All sides, top and bottom, of the sample containers should be decontaminated and then placed into a labeled secondary container with screw top. All outer surfaces of the secondary container should also be decontaminated before it is removed from the cabinet. All wastes are placed in a biohazard bag with sufficient water to generate steam when autoclaved, sealed with tape, and sprayed with disinfectant. The second step is decontaminating the cabinet and its contents. To do this, place all items within the cabinet on one side and then disinfect the opposite side. Surfaces that must be disinfected include the back, the side, the work surface, and the view screen. Once half the cabinet is disinfected, items within the cabinet are disinfected one at a time and placed on the clean side. All surfaces, including the top and bottom of each item, should be disinfected. Finally, the second side of the cabinet is disinfected. The cabinet's grate is disinfected last. Once the interior surfaces of the cabinet, the items within it, and your gloves have been decontaminated, and the disinfectant has been allotted sufficient contact time, the cabinet is unloaded. The waste generated while working is considered biohazardous. It is removed in leak-proof sealed bags and autoclaved within the animal facility. Animal tissues and carcasses are typically separated from other wastes, placed in cold storage, and incinerated as biohazardous waste. Although it is preferable to have all animals remain in the animal room, occasionally animals must be transported out of the animal facility. In these cases, 2 levels of containment are required. The caging system, typically a micro-isolator cage, is considered the primary containment, and its outer surfaces are decontaminated. Once the disinfectant has been allotted sufficient contact time, the top is secured and the cage is placed in a sealable secondary container. The top of the secondary container, in this case a larger micro-isolator cage, is also secured and covered. A biohazard tag is affixed to the outside of the container, and the animal is transported in a secure manner. Proper removal of protective clothing and equipment when exiting the animal room prevents contamination from spreading to other areas. When exiting the animal room, the most contaminated items are removed first. Booties, if worn, are likely to be the most contaminated items and are removed as one steps over the threshold of the animal room exitway. Outer gloves, if worn, are removed next, aseptically, turning them inside out. The disposable gown, or reusable gown or lab coat, is now removed. When removing clothing, try to avoid contaminating your gloves or skin by touching uncontaminated areas of the clothing and turning it inside out. A reusable gown should be placed in a biohazard bag, autoclaved, and then laundered. Inner gloves are now removed aseptically. Please note that all disposable protective clothing is placed in a biohazardous waste container. Finally, face protection and hair protection are removed. Face protection is the item least likely contaminated because all work is typically performed in a biological safety cabinet. After removing clothing and equipment, any reusable protective equipment is disinfected and the hands are washed thoroughly before exiting the facility.